Hi, this is Paula Ferris with DementiaCaregiving101.com. This video is about dementia patients and emotions. The dementia patient's emotions can be unpredictable. They can be difficult to understand, difficult to handle, and difficult to accept. But their emotions are very real. Educate yourself about dementia and about the normal progression of dementia symptoms. This will make your job as a dementia caregiver somewhat easier to handle. Dealing with my mom's emotions was one of the hardest parts of her care. It was hard for us to include her in conversations, especially when discussing her care, because she didn't understand what we were saying, but she knew we were talking about her, and she'd get angry with us. Here are some of the emotions the dementia patient may experience, and a few tips in dealing with them. Keep in mind that every person is different, and what I experienced with my mom may not be exactly what happens in your situation, but some of these tips may help you. Apathy and indifference. We would make plans to do something and tell our mom about them, and she would often reply by shrugging her shoulders and saying, "Whatever." We imagined she must have felt out of control since she no longer understood the logical sequence of making plans, so she resigned herself to do what she was told. Take a little time to ask the dementia patient's opinion sometimes. Of course, this doesn't apply to necessary plans like doctor appointments and grocery shopping. Depression and sadness. My mom especially experienced this when she was hospitalized. She would cry when I had to leave her. It was one of the hardest things I've ever done. Spend time with your loved one as often as possible and assure them of your love. This may not stop the sadness, but it will make you feel like you are doing all that you can. Anxiety. Mom would become very withdrawn when she was around a large group of people that she didn't remember. She preferred to be at home or at a certain restaurant that she and her husband frequented. Try to avoid large crowds, even if they're friends and family. A lot of people that your loved one doesn't remember are still strangers to her. Especially avoid loud noises like fireworks. Irritability. Mom would get very irritated when her husband had to leave her in someone else's care. She would spend the majority of the time complaining that he just dropped her off and didn't even say where he was going. That wasn't true, of course, but in her mind it was. Plan activities to keep the dementia patient occupied so that they are less likely to dwell on the thing that irritates them. A dementia patient's emotions seem to stem from the main problem, confusion. They have lost the ability to organize their thoughts, so they act inappropriately. Knowing what to expect and having a plan to counteract the negative emotions can make dementia caregiving much easier. If you like the information in this video, I have 20 more of them for you. Just go to www.paulaferris.com, that's www.paulaferris.com, to find out how you can see all 20 of these valuable information-packed videos for free. This is Paula Ferris from DementiaCaregiving101.com, helping to make your dementia caregiving journey easier. Thanks for watching.